Hormone replacement therapy, commonly known as HRT, is a medical treatment designed to replace hormones that the body no longer produces in sufficient quantities. Most often, HRT is associated with women undergoing menopause, a natural biological process marking the end of reproductive years. However, HRT is also prescribed for men with testosterone deficiencies and for transgender individuals as part of gender-affirming care. While HRT has been a transformative therapy for many, it also comes with significant considerations. To understand whether HRT may be right for someone, it's essential to weigh the benefits and risks carefully. Let's begin by exploring the potential benefits of hormone replacement therapy. For women experiencing menopause, the most immediate and noticeable advantage is relief from symptoms. Menopause can bring a range of uncomfortable changes: hot flashes, night sweats, mood swings, sleep disturbances, and vaginal dryness. These symptoms can be mild for some, but for others, they significantly disrupt daily life. HRT, particularly when started early in menopause, is highly effective at reducing or even eliminating these symptoms. Many women report a dramatic improvement in their quality of life: better sleep, increased energy, and a restored sense of well-being. Beyond symptom relief, HRT can also have protective effects on various aspects of health. One of the most well-documented benefits is its positive impact on bone health. As estrogen levels decline in menopause, women become more susceptible to osteoporosis, a condition where bones become weak and fragile. Estrogen plays a critical role in maintaining bone density, and HRT can help reduce the risk of fractures by slowing bone loss. There is also evidence suggesting that HRT may improve heart health when started near the onset of menopause. Some studies indicate that women who begin HRT within 10 years of menopause may have a lower risk of heart disease compared to those who do not use HRT. Additionally, estrogen has been shown to have favorable effects on cholesterol levels, which can contribute to cardiovascular health. For men with low testosterone, known as hypogonadism, HRT can restore hormone levels to a normal range. This often leads to improved mood, increased energy, better sexual function, and greater muscle mass. For transgender individuals, hormone therapy is a cornerstone of gender-affirming care, promoting the development of physical characteristics that align with a person's gender identity. This can have profound effects on mental health, reducing feelings of gender dysphoria and improving overall quality of life. While these benefits are compelling, HRT is not without its risks and drawbacks. One of the most significant concerns revolves around the increased risk of certain cancers. In women, combined estrogen-progestin therapy has been linked to a higher risk of breast cancer, especially with long-term use. Estrogen-only therapy, usually reserved for women who have had a hysterectomy, is associated with a lower risk, but can still increase the chance of endometrial cancer if the uterus is present. There is also a heightened risk of blood clots, particularly deep vein thrombosis and pulmonary embolism, in users of HRT. These risks are higher for women who take oral HRT than for those who use transdermal patches or gels. In addition, there is some evidence to suggest an increased risk of stroke and, in some cases, heart disease, especially when HRT is started many years after menopause. For men, testosterone replacement therapy may increase the risk of certain health issues, such as sleep apnea, blood clots, and possibly cardiovascular events. There is ongoing debate about whether testosterone therapy increases the risk of prostate cancer, but current evidence does not show a strong link. Another important consideration is that HRT is not a one-size-fits-all solution. The type, dose, and duration of therapy can vary widely based on individual needs and health profiles. Some people may experience side effects such as bloating, breast tenderness, headaches, or mood changes. For transgender individuals, the process of hormone therapy requires careful monitoring to ensure safety and effectiveness, as the risks and benefits can differ based on individual health factors. Given these complexities, the decision to start HRT should be made in collaboration with a knowledgeable healthcare provider. Before initiating therapy, a thorough assessment of personal and family medical history is essential. Factors such as a history of breast cancer, cardiovascular disease, blood clots, or liver disease may make HRT less suitable. For those at higher risk, non-hormonal options may be recommended to manage symptoms or address specific health concerns. It's also important to consider the duration of HRT. Most experts agree that the lowest effective dose should be used for the shortest period necessary to relieve symptoms. Regular follow-ups with a healthcare provider are crucial to monitor for side effects and to reassess whether continuing HRT remains the best choice. In recent years, research has led to more nuanced recommendations about HRT use. The risks and benefits may shift depending on a person's age, the timing of therapy, and the presence of other health conditions. For example, starting HRT closer to the onset of menopause appears to carry fewer risks and more potential benefits than starting it later. Similarly, the use of transdermal preparations or lower doses may minimize some risks. Lifestyle factors can also influence the balance of risks and benefits. For example, maintaining a healthy weight, exercising regularly, not smoking, and managing blood pressure can help reduce some of the risks associated with HRT. For those who cannot or prefer not to use HRT, alternative therapies and lifestyle changes can also provide symptom relief, though they may be less effective than hormone therapy for some individuals. In summary, hormone replacement therapy is a valuable option for many people experiencing significant symptoms related to hormone changes. Its benefits can be life-changing, offering relief from discomfort and protecting against certain health risks. However, these advantages must be weighed against the potential for serious side effects, and the decision to use HRT is highly individual. Open, ongoing communication with a healthcare provider is essential to navigate these choices and to ensure that therapy is tailored to each person's unique needs and health circumstances. Through careful consideration and personalized care, HRT can offer a pathway to improved well-being for many, while minimizing risks for those who choose this treatment.